Good afternoon, everyone. My name is Mercedes Witowski, and I am the Executive Director of the New Jersey Council on Developmental Disabilities. Welcome to today's bipartisan Legislative Disability Caucus session focused on early childhood intervention and youth services for those with disabilities. Closed captioning and sign language interpreters are available for today's session, and this session is being recorded. It will be available along with all previously recorded sessions on the caucus webpage, where you'll be able to also locate members of the Legislative Caucus. And while our attendees today are in listen-only mode, please make note that you can locate the supporting organizations, sign up for mailings, and submit comments or questions on any topic, including today's topic, through the webpage. I'm hoping that one of our meeting organizers, I think Gary, will put a link to that page in the chat for you. Panelists, please remain on mute if you can. Let me start off by thanking Assemblywoman Ora Dunn of the 25th Legislative District for her commitment as co-chair of the New Jersey Legislative Disability Caucus and for taking the lead in this afternoon's meeting. I'd also like to thank and welcome the other co-chairs and their staff, Senate Majority Leader Ruiz, Senate Republican Leader Bucco, and Assembly Majority Leader Greenwald. A thanks goes out to all Senate and Assembly members, part of the caucus, and I'm just going to take a quick look in the chat. I'm sorry, in the attendee list, I do see Senator Bucco, Senator Corrado, Assemblywoman Lopez. I'm looking for you all, so I just want to say a shout out. Sorry, my screen is not cooperating with me. I see representative from Assemblyman Benson's office. Let's see, Senator Stanfield, thank you for joining us. And Assembly Majority Office, Cora is also here. So thank you. If I've missed anybody, please wave to us, give us a hello. We're glad that you are all joining with us today. I also would like to thank our speakers who are joining us today, and thank Bob Titus, who is Public Policy Coordinator at the New Jersey Council on Developmental Disabilities, for helping to assemble our panelists. He worked with Kathy Chin at ABCD and also with Deb Wentz at Najama to help bring you a robust and astute group of panelists to join in this conversation. So while this caucus serves as a bipartisan forum within the New Jersey Legislature, we look to certainly consider the impact on the disability community as a priority in shaping all public policies. And this, we know, can be accomplished through these conversations, engaging with system leaders, people with disabilities and their families, and those organizations that serve and support them, and providing that insight that's so necessary. I also want to take a moment to just acknowledge that July is Disability Pride Month, and to point out that tomorrow marks the 33rd anniversary of the Americans with Disabilities Act. So I now turn over the session to Assemblywoman Ora Dunn, who has demonstrated her fierce leadership in the caucus. She's shown her dedication to disability issues by doing things like taking the time to listen, engaging in conversations, always asking the right questions, Assemblywoman Dunn, even though we may not have all the answers, and is a genuine interest in identifying and improving supports and services for people with disabilities. So we're grateful for your leadership, Assemblywoman Dunn.
Thank you, Mercedes. And this couldn't be done without you and your leadership. I really, truly appreciate our partnership and all the collaboration that we've done since the founding of this caucus. It really is an honor for me to be a co-chair, since I really feel that this is a reflection of really my life's work, and particularly the focus of today's forum on child well-being and mental health. So, and I'd be remiss if I don't thank the entire team that has put this forward. I'm so glad, Mercedes, that you took on the task of introducing my colleagues, because I'm sure I would have missed somebody. So good to see all of you, and thank you to my co-chairs, Majority Leader Lou Greenwald, Majority Leader in the Senate, Teresa Ruiz, and Minority Leader in the Senate, and my colleague in District 25, Anthony Bucco. So yeah, we can get started. We're looking forward to hearing from the speakers, Mr. Harisco, Mr. Holmes, and Ms. Buchanan. So we know that children are facing really an unprecedented challenges today. And I feel as a legislator, and I know with my fellow legislators, we know it's our obligation to make sure that the state has the right policies and programs in place to meet these children where they are and to make sure they get to where they need to go. And of course, a part of that is quality early intervention services, making sure that babies, toddlers, preschoolers have what they need for important developmental milestones. And we will talk a little bit today about really a major policy shift that took place just this year in creating 15 hubs throughout the state to deliver mental health services to, I know we have more than 1.2 million children enrolled in K through 12 programs alone in our state. But we know to be truly effective, we've got to target and address the evolving educational issues and mental health problems amongst our children. We have experienced great learning loss. Unfortunately, we rank lower in terms of that learning loss and our testing scores. Then we are below the national average on that. And the number of teens in New Jersey experiencing sadness and hopelessness is at an all-time high. The rate of depression is so significant that we are at the point of a public health emergency. So our meeting today will help us inform those policies and really, truly, hopefully serve as a beacon of hope for all of New Jersey's families as we enter, in many ways, uncharted territory. So again, I thank all the participants, thank the audience, the staff, the team for putting this together. I know this is going to be a productive, solutions-focused discussion, and I can't wait to get to work. So thank you.
Let's hit that mute button. Thank you, Assemblywoman Dunn. Thank you for initiating this session today. Early intervention is the term we use to describe services and supports to help babies and toddlers, the birth to 3 years of age, who show signs of developmental delays or disabilities. Those services include a variety of therapies, but they also give the family an opportunity to do better, to understand maybe a disability or a learning delay, and helping their child and that family unit through the next step. The other stage that we'll cover today are the access to services for children and adolescents with disabilities. And while we recognize the transition years are also critical, those 16 to 21 years of age, we have decided that the Legislative Disability Caucus will take that on as a separate issue on the October 24th session. So tune back in on October 24th at noon for the transition to from school to adult life. We are fortunate in New Jersey to have the safety net of things like Cover All Kids within our New Jersey Family Care Program, and the investment that New Jersey has made in children mental health services. And what we'll cover today are some of the access to, children's system of care, managed care, school-based services for children with disabilities and mental health challenges. But we recognize the limitations of our time together. And we know that there are more issues for this age group that are worthy of our attention. The caucus supporting organizations, they listen to families and recognize the need for more intensive services at home, in out-of-home settings, particularly for children with intense medical and behavioral challenges. We also recognize the struggles that are faced when trying to access physician and specialty medical care services, time that we wait on appointments. At the New Jersey Council on Developmental Disabilities, we have a priority and an aim to eliminate the inappropriate use of seclusion, restraint, suspension, and expulsion for Black and Hispanic students with disabilities, and with an additional focus on looking at the high rates of referral to law enforcement and how we as a council better educate and provide technical assistance that offers alternatives to really harmful practices for our young people. We also prioritize the safety of students with disabilities, and Assemblywoman Dunn, we've spoken about the school safety bill, A 1174, and the companion Senate Bill 2057 that focuses on school safety standards for students with disabilities in school emergencies. So we're appreciative that this bill has advanced, but we are also welcoming the final steps of this becoming law in the fall. So we ask that attendees please use this opportunity to let us learn about the other issues that are facing young people and their families. And you can do that through the link through the webpage for the caucus in the chat. So I'm going to start by introducing the first of our three speakers today. We'll start the conversation with information about early intervention services, challenges, and solutions. And then we will pause between speakers for some time for our legislators to engage with our speakers and ask any questions. So our first speaker, K. David Holmes. David is the founder and president, CEO of KDH Enterprises, LLC. And he's been there since he had first formed the organization. His firm provides consultative supports and strategic management solutions to nonprofits, to state agencies, provider associations, hospitals, and small to medium-sized for-profit corporations. Since 1980, he has directed and administered programs in the nonprofit arena focused on supporting individuals with disabilities, as well as the public sector, state and government, with a concentration on welfare programs and the distribution of state and federal resources within New Jersey. David has served as adjunct professor at the Graduate School of Education, Leadership, and Counseling at Rider University for 20 years. He received his bachelor's from Princeton University and multiple graduate degrees from Rider. David, we are very excited that you're joining us and look forward to your conversation about early intervention.
Mercedes, thank you very much for those kind words. Assemblywoman Dunn, thank you for having me and your leadership, the legislative leadership and their staffs. I appreciate you participating today. I'm just grateful to be able to express some thoughts regarding the early intervention system here in the state of New Jersey. As we said, my name is David Holmes. I'm the president and CEO of KDH Enterprises, which is a small management consulting firm that has been in existence for 19 years. One of my contracts involves working with the Alliance for the Betterment of Citizens with Disabilities, referred to as ABCD, and more specifically, providing technical and strategic support to the Early Intervention Provider Association, referred to as EIPA. You're going to hear a lot of acronyms, which is the industry, and I apologize for that. This EIPA is a membership organization of 13 provider agencies in New Jersey that specifically provide early intervention services to approximately 60% of the total number of families on an annual basis. This group of very sophisticated providers meets monthly in an effort to provide advocacy and strategic positioning for the organizations associated with EI. Of late, our largest accomplishment has been the 7.5% increase identified in the governor's budget for 2024 to support an increase in the fee-for-service rate provided to the EIPAs. And I'll give you a little bit more information on that in a few minutes. I realize that not everyone is familiar with early intervention. So allow me a few minutes to provide you with just a very brief picture. EI is Part C of IDEA. Okay, so here's more acronyms. Individuals with Disabilities Education Act. The act provides for in-home services in natural environments for children between the ages of 0 to 3 who are deemed eligible through an evaluation process. Just to note, the sister part, Part B, is the larger part of IDEA and provides public and private education from ages 3 to 5 and 5 to 21. EI is housed in the State Department of Health. It's been there for approximately 18 years. It has also been housed in the Department of Human Services as well as in the Department of Education. The total budget is approximately $225 million. It comprised of federal dollars, state dollars, Medicaid, and family cost share. There are approximately 17,000 children that flow through the system on an annual basis. If you can picture a stool, there are 4 legs to a stool and 4 areas of the delivery system. The Part C office in Trenton provides the overall administration and vision for the services. There are 4 regional early intervention collaboratives that provide training and child find services and assist the provider agencies. There are 18 service coordination units, and that's the case management component of this organization. And there are 53 provider agencies who employ 5,000 plus practitioners who are physical therapists, occupational therapists, speech pathologists, special educators, nurses, etc. Also part of the system, there is a governor-appointed statewide interagency coordinating council, referred to as the SICC. That group provides advice to the commissioner of the Department of Health, and they meet on a monthly basis, on every other month basis. From a process perspective, families self-refer through a 800 telephone number. And actually, our largest referral source are physicians. I mean, if you can imagine children between the ages of 0 to 3 going for regular doctor's visits and getting identified with delays or issues that need to be addressed, get referred directly to the physician's office. Children are referred to the service coordination units, the 18 units. They're assigned an evaluation team. The team does an evaluation. An individual family support plan is developed. A service provider organization is assigned to that family, and the providers provide in-home services to the children up to the age of 3 years of old. I will note also that 6 months before you hit the age of 3, there is transition planning occurs to facilitate the integration into the Part B of IDEA, the preschool handicap, etc. For purposes of our discussion today, I have terribly simplified the processes and systems that are established, but I assure you that they are highly regulated by the federal government and very complex. I have done a pretty significant stint in the welfare system in New Jersey as well, and I can tell you they are every bit as complex and complicated as the welfare system. But allow me to share with you some of our most significant issues and hurdles that exist. Number one, in 2018, there was a change made to the early intervention management system. This is the system where all the information comes in, the family situation, the billing, everything goes into this management situation. And basically, it almost brought the EI to its knees. The system was being built it's like flying a plane and building it as you're flying. And unfortunately, the system was not built completely. And provider agencies were only seeing about 30 to 40% of their revenues. Ultimately, ABCD advocated and received loans for the provider agencies from the legislature, which I can't tell you, we are forever grateful. The system was on the verge of collapse, very seriously, and you gave us an opportunity to keep services going to these families. The second major issue that occurred in 2019 was the onset of COVID. Families were afraid to have practitioners come into their homes. Practitioners were afraid to go into the homes. In a 2-week period, we had a major transition to telehealth. The entire system flipped to telehealth. Many practitioners actually exited the system. Last week, there was a meeting with the new director of early intervention, and she has estimated that there was at least a 15% reduction in the number of practitioners, therapists that have been in the system during this period of time. Many families chose not to have the child even enter the EI system, which only further complicated their delay. We're seeing children right now who are very, very close to age 3, who have significant disabilities and require significant level of service and support, and that possibly could have been helped if they had gone through the system earlier. We are still to this day recuperating from this lifestyle change. In fact, the 7.5% increase this year came from unexpended dollars in the Department of Health. And that kind of goes to show you, I mean, I kind of wish that those dollars were made available sooner than just at this particular time, because there were many, many agencies that were not hitting the pre-COVID rate revenues that they had that were in existence beforehand. In 2019, the Department of Health also took our recommendation and had a rate study done to assist in updating provider rates. The year-long process resulted in a material increase in rates, but we have yet to actually see the report. We know we are losing practitioners. We know we're losing PT, OT, and speech practitioners. We know we are in competition with schools, hospitals, long-term care facilities, and private practice. But the fact is, we don't have any real data. We don't have any data as to where EI is on the pecking order. So we assume pediatrics is at the bottom. And we also believe that home-based services is at the bottom of the pecking order. We need to actually advocate for a formal study to better understand the inflows and exits of therapists in New Jersey. And you could possibly be very helpful in this endeavor. The fourth item is the State Interagency Coordinating Council. We have a vacancy on the council. We need a legislator on that council. Remember, this is a position that meets every other week for 2 to 3 hours, every other month, I'm sorry, for 2 or 3 hours. And having that level of commitment from the legislature and communication directly with the commissioner would be very, very helpful. We are working on many other policy and system changes that I wish I had time to discuss today, but in the essence of time, I'll leave you with the following. We need a legislator on the SICC. Please give that some consideration. We need competitive rates to pay our providers and practitioners, because today there's a significant wait list where 1,600 children are waiting to receive a particular service, and we're struggling to meet their needs. We need to see a final copy of the rate study. So if you can gain access to that, I would be most grateful. And lastly, when you hear the term early intervention, please have a sympathetic ear. These are very young families who are struggling to manage very difficult family issues, where they depend on our state system to respond to their needs quickly and efficiently. Please be generous with your governance. And most of all, I thank you for your past efforts and what I hope will be your future support. Thank you.
Thank you, David. You had some very specific asks, and without putting anyone on the spot, I think anyone in the legislature, I think if anyone has any interest in connecting with David on his request for a legislator to serve on that council or any other insight, we're going to pause for a minute and give you an opportunity to unmute yourselves. We've got great support today. I see Assemblyman Moriarty's office here as well. So anyone? Senator Corrado, Assemblywoman Dunn, Any reactions, any questions for David? Not putting anybody on the spot. But that's why we're here, right?
Sure, you're not, Mercedes. No, I just want to say thank you. It's, you put it right there in digestible format, and it's definitely something we will consider and discuss amongst ourselves. That's the purpose of these meetings. Wasn't even aware that vacancy existed, and even the rates at which I knew we've talked about backlogs, but I didn't realize the extensiveness of it. So I just want to thank you and know that this is noted, and we will be discussing it further.
Thanks, Assemblywoman. And I do see a request for emails for the speakers. We will get that out to all of the caucus members, contact information for our speakers today. I also want to thank Assemblyman Varelli for just joining us as well. So great presentation and education information. And we know how important it is in those early years to get the services that children identify as needing, because that really shapes the next years, the young child, adolescent years. And if we make that investment early on, we know data proves that the success of our young children, our 0 to 3-year-olds, will be beneficial for the long haul, not just for the child, but also for that family. So thank you for that, David. I will now invite our next speaker, Mary Jo Buchanan. She is the Executive Director for Ocean Partnership for Children, Ocean County's care management organization. She leads one of the 15 care management organizations in the state as part of the Children's System of Care. Mary Jo has over 40 years of experience in the field of social work. She's a licensed clinical social worker. She serves on the board of the New Jersey Association of the Mental Health and Addiction Agencies, and we are delighted to have you join us today, Mary Jo, to take us through Children's System of Care, managed care challenges, and solutions. So get ready, Mary Jo.
Thanks so much, Mercedes. Now I feel really old with that introduction of 40 years in the field, but good afternoon, and thank you so much, Assemblywoman Dunn, and everybody who is on this call for the privilege of being with you today to talk about access to youth behavioral health services. I'd like to discuss our state's children's system of care, as well as challenges to the system that I see and some opportunities for change. As we've talked about, there is a children's mental health crisis nationally, which is playing out right here in New Jersey as well. The children's system of care is seeing the highest number of youth, with currently over 34,000 youth receiving services. Youth are presenting to us with anxiety, depression, self-harm, suicidal ideation. These are serious issues. While the system of care serves youth up to the age of 21, youth age 16 and under, that's the fastest growing population in need of care. I'd like to start by quickly reviewing the children's system of care, or as we call it, CSOC. CSOC is a comprehensive array of services for youth with mental health, behavioral health, substance use, and neurodiverse challenges. The system coordinates care, utilizing a variety of community and out-of-home treatment providers. It is also a managed system, so all youth and families must access it through the contracted system administrator, Perform Care. Calls from families and caregivers are answered by Perform Care, who determines which component of CSOC can best meet the need. So if there's an urgent need, mobile response will be dispatched. If there's a longer-term care coordination need, the referral is made to a care management organization or a CMO. And if the caregiver or a parent needs support, a referral can be made to the family support organization. There's no cost to the family at CSOC because the services are on the Medicaid platform. While youth and families are accessing the children's system of care in record numbers, the challenge is that there are still many families in New Jersey that are not aware of these services and don't know how to access them. I recently had a father of a 16-year-old son who has both autism and a behavioral health diagnosis tell me with tears in his eyes that he wished he would have known of our services much earlier. So access to CSOC service is the first challenge that I want to acknowledge. In addition, even if the family finds out about the children's system of care, think about how hard it is to make that call and to fully describe what's happening with your youth. It's hard to admit that your youth may be out of control, hitting and punching or threatening to harm themselves, but that's exactly what the families need to share in order to receive the services through the system. CSOC has tried a variety of ways to publicize services, but there's still that incredible awareness gap. To strengthen the system, even more and creative outreach to families need to occur where those families are, in the language that they speak, and through technology. All of us have to help with this outreach and help coach our parents and our caregivers so they know how to make the call. And quite frankly, I've even considered almost like a prep sheet for the families to use when they call Perform Care, so that that can be most helpful in accessing the services that they need. The access to service issue doesn't stop with CSOC. Unfortunately, once our youth come to the children's system of care and even to our care management organizations, as mentioned earlier in early intervention, there's also an incredible lack of access to treatment providers. The pandemic has had a terrible impact on our providers who can no longer afford to hire staff given their current reimbursement rates. Clinicians now want to do telehealth. That's not what our youth need. They need to have eyes on them and they need to be seen in person. While CSOC recently raised rates, and we're very grateful for that in the most recent budget, it's not significant enough for providers to be able to afford the increased salaries being demanded. Many of our providers have gone out of business or have huge waiting lists, and this is an issue statewide. So CSOC must continue, and we all must continue to advocate and address the rate concerns. And I also would advocate for regular rate increases. While I acknowledge there's many competing interests in the state budget, our youth and families deserve this advocacy. Another access issue is that the ABA services have been carved into the managed care organizations or the MCOs. And the carve-in of behavioral health and mental health services is on the horizon as well through the 1115 waiver. The MCOs are insurance companies and they're managing and coordinating care, but from that insurance perspective. Each MCO has its own rates. There's no standardized rate per service. Each MCO has its own process for credentialing providers, which is often difficult and lengthy. And that leaves not only our providers in limbo, but also our youth in limbo for the services who they need most. Each MCO also has its own billing processes and codes. And again, the process of billing is really arduous. A lot of claims are lost or denied. So again, providers are not being paid, they can't sustain themselves, and our youth are not being served. These issues are demonstrated by a recent report from the U.S. Department of Human Services Office of the Inspector General. And I quote, overall, the MCOs included in our review denied 1 out of every 8 requests for prior authorization of services. And that to me is really concerning. So oversight of the MCOs is a critical issue at this time, not just for ABA services, but for the eventual carve-in of behavioral health services as well. And while the Department of Human Services has been engaging in dialogue with the MCO, these issues still remain and need to be addressed. One potential suggestion from my perspective is to form an MCO oversight committee, including the state, but also the providers themselves, those in the system of care, advocacy groups, and the youth and families themselves. They need to have a voice. I want to highlight another challenge facing the system currently, and that is access for youth who are struggling with both behavioral health and neurodiverse challenges. When these youth go into crisis, the hospital emergency departments are ill-equipped to provide adequate care. And yet again, because of lack of providers, both in the community and in out-of-home treatment settings, these youth are often stuck in the emergency room for days, weeks, and sometimes even months. The hospital staff are at a loss, crisis beds of any kind are at a premium. Families are frustrated beyond belief, and the youth, unfortunately, often decompensate. In summary, there are real challenges in our children's system of care currently. The majority of these challenges, I believe, relate to access to care, including families being aware of available services, families needing to know how best to access them, challenges of accessing services through the MCOs, and access to crisis care for our dually involved youth. All of those remain to be concerning. So I sometimes feel a little overwhelmed, as I'm sure we all do, with the challenges, but I really do think they can be solved by continuing to increase rates, regularly increasing rates to our providers, a little bit more intensive oversight of the managed care organizations, and training of our providers and hospital staff to manage those dually diagnosed youth. All of us are here as advocates, and I'm honored to be among you. But we really need to join together, and we need to work across the systems, across every state department, because every state department touches our youth. So I really encourage all of us to come together and advocate in one voice and address the issues and some of the challenges that I've brought forth. And again, thank you so much, Assemblywoman Dunn, and all of you who are involved in this meeting for putting all of this together. I think we have a lot of work to do together. Thank you.
Thank you, Mary Jo. Very crystal clear in your remarks. I'll invite our Senate and Assembly members for any comment, questions, thoughts. Well, I know you'll, Assemblywoman Dunn, go ahead.
I wanted to at least give the floor to everyone first, but I will say thank you for that. Really, we talked about in our preparation about having, almost like a walkthrough, and even if we've heard it once or 10 times before, it is a complex system that we all can continue to be educated on, so we could make the change. So thank you so much, Ms. Buchanan, and legislators, and I know staff will appreciate that are on this call. We love a one-pager. We love a fact sheet. So your first recommendation, I can see it already. We can make that, we can bring that goal to fruition. So thank you.
Thank you. So then I will invite our last panelist, certainly not least. I'd like to introduce you all to Jacques Harisco. He's been with Family Connections for over 28 years, and he's the CEO since 2015. Family Connections delivers a wide range of services across northern New Jersey, including counseling, prevention, training, family bonding, family reunification, social emotional skills building, and many more. As a provider of a licensed mental health and substance use treatment provider, Family Connections, they work closely with resources in the community. Jacques has his BS from Union College and his master's degree from the State University of New York at Buffalo. He is a licensed professional counselor and an approved clinical supervisor. He's also currently serving on the board as chair of the New Jersey Association of Mental Health and Addiction Agencies. We welcome you, Jacques, to our session today.
Thanks, Mercedes. That was very, very gracious. And thank you so much to the Legislative Disability Caucus, and thank you, Assemblywoman Dunn, for your work and promoting our work. Thank you. And thank you to all the legislators for your concern, your interest, and your advocacy. And yes, advocacy. And thanks, David and Mary Jo, for what you said. You were strong in your comments regarding support that's needed at this critical time. Family Connections is just so grateful to have received just this past week our funding allocations for the Department of Children and Families contracts, and that those contracts all had a 7% increase, and that is the first increase that we've had in 16 years. So it's, we're incredibly grateful. However, if you do the math, that's less than a 0.5% increase each year. So this is a tremendous start. But more advocacy, more support is needed. As was stated by Mary Jo and David so well, we're absolutely in a staffing crisis. To find licensed clinicians who are half of Family Connection services is provided in the community. And to find licensed clinicians who are willing to do that work is so challenging. We have many positions that have been open for over a year because licensed clinicians at this time are going to private practice. They're going to for-profit companies. And to be clear, those entities are not serving the communities that we serve. For Family Connections here in Essex County, over 80% of our families served live below the poverty line and identify themselves as Black or Brown. So it's clear that we are serving families who would not be getting services otherwise, because that's not who these other entities are serving. And just to go back, so as I said, it's been 16 years since there was a contract increase, and absolutely one of the reasons for the contract increases are so needed is the skyrocketing salary demands that are happening, but also the cost of care. 16 years ago, Family Connections and agencies did not have electronic health records. Currently, our electronic health record, just that by itself, that software system we have to lease, that's over $100,000 a year. And then it needs other IT platforms to operate on. And of course, it needs IT staff to support. So just the cost of keeping up with regulations is so much more expensive than it was even 16 years ago. So please, with your advocacy, greatly appreciated. So as both David and Mary Jo said, we here in New Jersey are very fortunate to have some systems, our current systems, and I will give tons of credit to current legislators, past legislators, and past governors and department commissioners for listening to the needs of the community. It was about, correct me, Mary Jo, I think it was about 20 years ago that the system of care was evolved. And the reason that came about was that families, Mary Jo spoke of access, families did not know how to access services. And it seemed at that time, the reality was how people access services was at the point of crisis, whether they were in court and were court referred to programs, or a situation had developed so it was severe and it was in school, and a school staff person was referring to counseling. What was the reality 20 years ago was that the service that you were referred to very much depended on where and how the crisis was developing. So whatever door you entered was the service provision that you received, and the services were very much siloed. So the vision of having a single point of entry and having a single phone number where any family could call and have access, first have a system that involved a care management organization, such as the one that Mary Jo leads, or a crisis response team, and a family service organization in every county. That's phenomenal, and other states do not have this. And This system then refers families and adolescents to either set up services that can be provided in home, or they refer to community agencies. And Family Connections I am speaking of Family Connections, but I'm also speaking of other community providers. Family Connections is a licensed substance use and mental health treatment provider, and it's from that kind of perspective that I really wanted to speak. So we get many referrals from the Children's System of Care here in Essex County, and if not for that system, I know that families wouldn't be accessing the service. I also wanted to mention, just here in New Jersey, another reason to be fortunate that in April, funding for a brand new program, the Statewide Student Support Services, or NJ4S, started here in New Jersey. And the reason, what I'm going to say, the reason that program developed was a recognition that of the mental health crisis in New Jersey, but also a recognition that therapy could not be our only solution. That to improve the mental health in our communities needed a much broader set of tools than just therapy or clinicians. For one, there's not enough clinicians. Two, that's the most expensive form of services, and it's not the most ideal. David spoke so much about and so well about early intervention services. Early intervention needs to be much more enhanced, and Mary Jo also spoke of the efficiency and the cost effectiveness of providing early intervention services. The NJ4S model will be depending a lot more on prevention services as well. And prevention services is a large umbrella that describes a wide range of services that are not therapy, but are intended to improve the mental health of individuals in the services. So, for instance, in our school-based programs, we run adolescent groups, social skills groups, and these groups give students the opportunity to connect with one another and to form relationships and to develop socially in a much healthier way. The parenting groups that we run are very much on the prevention side. So I'll describe it as kind of like counseling light, but is a much more efficient, much more effective, and I'm going to say a much more natural way of providing services. So the NJ4S looks to enhance services in the community at a much fuller spectrum. Yes, there's mental health, and there will be clinicians in the program, but that will be a very small piece of the services provided, because, as I said, it's the most expensive. These services, this program now is looking at a rollout of September, which will be very soon, and the state has a very clear vision for this program, and I'm going to give the state just tons of kudos for not only designing this program, but also it's clear that they're heavily invested in the success of the program. And with this implementation program, in this implementation process, they're very much at our sides, and it's very much a partnership in the implementation. The other piece that's important in the implementation will be the community advisory boards. and working with each school, because this is not a model that's going to be just pushed onto each community, but it's a model that's asking each community to identify its needs and to identify a solution or a structure that can provide support for families. And that's part of why we're so pleased and proud to be a part of this. I could go on. I think to have two systems of care in New Jersey, and it's also the clear intention of the state that these systems cannot be in silos. They will be working with one another to support and enhance each other's strengths. So I'm going to leave it there and thank you to all the legislators for your past support, and moving forward, we need your continued support. And as Mary Jo said, please an annual cost of living that's legislated into a consumer index would be greatly appreciated. I think it's assumed that every year provider agencies get an automatic increase. That is not true. For a DCF, it's been 16 years. Thank you very much.
Thank you, Jacques. I really appreciate your giving us that educational, informational, and we are proud at the caucus that we're not afraid to ask. That's what we're here to do, is we're here to kind of show and tell, and also make sure that our legislators are aware of the issues. So we appreciate all three speakers today. I know access to services, information about services was a common thread for all three speakers. And I want to thank for a minute the legislative offices, because I know we get calls at the council, and I know the other supporting organizations get calls when constituents come forward because they have an issue they need to address. So, there's a beauty in this caucus in connecting constituents to services, connecting providers to issues in their communities. So I'm very appreciative of that. I want to make sure that we have that opportunity for anyone with any questions for our third panelist, Jacques Harisco. We'll open up for any questions. Please unmute yourself. Thank you, Assemblywoman Marilyn Pincero, for joining us today. I saw you join. Any questions, any comments, thoughts, and reactions to any of our panel speakers today? Don't be shy.
Mine is more of a comment. I wanted to thank Mr. Harisco. The timing of when you came to present, I think was perfect, because it gives us that you kind of summarized much, but then also gave us that look forward, and particularly with the implementation of the new student service hubs. We know that we're a state of more than 700 school districts. So you mentioned those advisory boards. It'll be no easy feat, but it really is promising to know that there'll be that kind of input, because I believe firmly that solutions really are best when they come from the bottom up instead of the top down. And we're finding that we're battling with that right now in our education systems. So looking forward to seeing that unfold, and very promising to know that there will be these boards these really localized boards to be part of this rollout.
Thank you, Assemblywoman Dunn. Any other legislators wish to make any comment at this time? Please unmute yourself.
I just want to thank the speakers for their information, and each one of them was so passionate and articulate in what they had to say. I know Assemblywoman Dunn mentioned it before, that for us, a lot of times this is a listening. We're here to get the information and figure out how we can work with you and how we can help. And every time we do one of these caucus Zooms, I learned something new. The one thing that stuck with me was it can be overwhelming, especially when you have a child, whether it's a very young child that needs early intervention or an older child that's looking for some type of preventative intervention. And so how do we make it easier on the families and easier to get the services and make sure that we take care of our service providers as well? So it was a lot of information. It was really good information. I always appreciate what we do in these Zooms, and I learned something every single time. So I just want to thank everybody that was part of it. It's really meaningful.
Thank you, Senator.
Thank you.
I agree. These conversations definitely spark communication and really are key to advancing our policies and increasing, and in this case, hopefully equitable access to the critical services for our young population. We have another minute or two before we close today's session. Any other legislators wish to comment?
Not a legislator, but just a comment. Absolutely. Thank you. That was, it is overwhelming, but it's also natural, because raising children can be very overwhelming. And if families can be together and parents can be together to support one another in that process, that is the most natural and that is the most helpful. And it's, we work here at Family Connections in Essex County, we work in very urban environments, but families are isolated, and the prevention programs, early intervention programs give us opportunities to build networks within families.
That's a great sum up. Thank you for that, Jacques. So remember, on October 24th, Senator Ruiz, a co-chair of the caucus, will be hosting the session on the transition years for individual students from school to the adult system. Another important conversation that we knew we would not have time to cover today. So we look forward to that next session. Thank you, Assemblywoman Dunn, for shining a light on our young children with disabilities across our state. Thousands and thousands of children and their families depend on our conversations and our work in this area.
Thank you, Mercedes. I just can close. I feel, we're moving toward, it's about mental wellness for all of us. I think when we talk about our efforts to destigmatize mental health, sometimes brings up all kinds of connotations, but really it's about all of us pulling together and having just a healthy and healthy and sound future for all of the children of the state. So thank you.
Thank you. Enjoy the rest of summer, everyone. And we'll see you, if not before, we'll certainly see you on October 24th. Thank you again.